mental health disparities in rural Arizona present a significant challenge. In the southeast counties of Cochise, Santa Cruz, Graham, and Greenlee, people face unique socioeconomic and infrastructural barriers to accessing adequate mental health care. For SEAHEC, the Southeast Arizona Health Education Center, addressing these barriers has been the core of their mission since 1985.
And my whole goal was to get them home safely and to get them home well.
Now, a $6 million National Institutes of Health grant will fund a 5 to 10-year community research project to identify and address the lack in resources in these counties.
The project's name is Proyecto Juntos.
We have a long history of health workforce development.
We go to every county and we do focus groups with the community. They are the eyes, they know what is lacking, what is working for them. I'm the lead on Cochise County.
Cochise is the largest of the counties. For a population of over 125,000, has just 113 mental or behavioral health professionals.
For Cochise County, the lack of services, the legal status. There's a lot of immigration component in Cochise. The other day, it was an accident, and police took 1 hour to go to the accident. So 1 hour. Obviously, this person passed because he didn't receive the services he needed to survive.
Graham and Greenlee County would be the same thing, it's lack of services.
Graham, with over 37,000 residents, has only 27 mental health professionals, while Greenlee, the smallest of the counties, with a population of over 9,000, has just one social worker. Both Graham and Greenlee have no psychiatric workforce.
When we held our focus group, we heard a lot from the actual participants, 14 people there. Almost half of them had a personal experience with mental health or behavioral health. And the fact that they had to travel outside of Graham County to like Tucson or Phoenix to get any kind of services was the big problem there.
Here in Nogales, there's a lot of care coordination issues.
Santa Cruz, with a population larger than Graham County of almost 50,000, has even fewer mental health professionals, with just 19.
During our focus groups, we had over like a year of a waiting list for an intake up in Tucson for behavioral health. And then the transportation comes after. Once they get that appointment, do they speak the proper language?
One of SEAHEC's programs is Project Nourish, partnering with local agencies in Graham and Greenlee County during the pandemic to address food insecurities. Relationships like these has served as an entry point in identifying the major gaps in resources in these areas.
What I believe makes SEAHEC different is that we go where the people are. Here at Dunkin' Food Pantries, they have been very welcoming for the past years.
Good morning. By the beginning of 2020 is when we opened here with our full site and a full-fledged food bank, and it ended up being perfect timing because COVID hit. 2 years ago, we were approached by United Way, noting the need for a food bank in Clifton. There was nothing. And so we went ahead and took on that too. So we've been doing that about almost 3 years now.
We're providing information with local resources for diabetes education classes here in your community, heart health education. We are providing some healthy recipes based on the donations that they will be given out to the community from vegetables, fruits, and we provide all of our material. It's rental assistance. They've also requested like heart health information, chronic disease prevention.
There's also some tips on how to protect your heart and keep your heart healthy. So when you start going to car, you're more one-on-one. People tend to open up. I remember talking to somebody about a family member of theirs having substance use problems, and knowing that there wasn't too many local resources, we made sure that the next time we came, we had that information available.
Each community we work in, it's unique. It's very, very different. We first come, shadow, and learn from them.
We run about 800 people in the town, maybe around 1,200 with surrounding areas. The main industries are farming and ranching, and the mine up in Morenci, about 45 minutes north. It does provide us the largest employer in the county. The second largest is Greenlee County government itself. The challenges of a rural community are that if you're not with the mine, then you're going to have a really hard time finding a good paying job. Along with the generational pride in families, we also see generational poverty. We do not have resources here in our county for mental health, for domestic abuse, the shelters and things. They're not here. You're lucky if you can get into Safford.
Across these 4 counties, a critical shortage of mental health professionals exists. A severe lack of psychiatrists, psychologists, social workers, and counselors is pervasive. This scarcity is compounded by vast geological distances, making access to already limited resources even more difficult.
Our meetings are open, and as we go, we try to see who the partner is or organization, invite them so we can start working together. We invite, for example, ADOT to our meetings. They see not just the transportation, but having better internet or, an extra tower there, or being able to provide that will also help.
Transportation barriers, lack of broadband internet for telehealth services, and the stigma surrounding mental health further exacerbate the problem. The consequences of these disparities are significant. Higher rates of suicide, substance abuse, and untreated mental health conditions are reported in rural areas compared to urban centres. Limited resources also strain law enforcement and emergency services, who often become de facto first responders for mental health crises.
But the main focus of this is to actually identify all the services that we have. We have organizations from law enforcement, academics, other nonprofit organizations, behavioral health services, and our local clinics.
Each organization found a champion of the community or several champions, and we set up the focus groups.
So all of us together are able to meet bi-monthly.
The goal of this work group is, as part of the Santa Cruz County Drug-Free Community Coalition Subcommittee, COVINAS, the Binational Health Council of Ambos Nogales, and the local HERA, which is...
And literally what it is a group of people who are working towards the same goal with mental health and behavioral health. Do you want us to go over here?
Listening sessions are a crucial part of Proyecto Juntos, offering a wealth of valuable information and insight.
We have access to childcare that was mentioned. We have eligibility to Wi-Fi or internet. We had a voucher that was going around when the pandemic was at its strongest, and that recently expired. A lot of people are using hotspots and stuff to power their children's, home devices and all of that to get their homework done.
There's people out here that are working, that aren't access. They make $1 more than what they're supposed to, and then they get kicked off the program. Okay, so how can we change that so that way that stressor isn't on the people that are working?
We know that we have community members who sadly are falling through the cracks, and we need policy change and advocacy to make those gradual changes, and it doesn't happen in 1 year.
This is also why it's a good strength that we have multiple rural counties joining together, because oftentimes mental health is not at the table in policy. And if we have multiple rural counties joining effort and bringing data to the table, it's harder to ignore.
Increased funding for mental health services, recruitment and retention incentives for professionals in rural areas, expansion of telehealth infrastructure, community-based mental health programs, and destigmatization campaigns are crucial steps. Understanding the unique needs of each county, including its demographics, economic base, and cultural context, is essential for developing effective and sustainable solutions.
One of the main things we say to the community is this project is like for 5 years and extend to 10 years. We are not going to address the barriers like next month or in a year.
Fix it right away.
Exactly. We're going to take a lot of time because we need time to address those things. So
Any initiatives, anything that's going to happen, it's going to be led by the community. It's not going to be led by us. It's not going to be led by NIH, the government. No, it's going to be the actual community.
The way to also make those programs sustainable is definitely connecting with the right people, which are the local organizations there and the people. We want to empower those counties to have this sustainable, and hopefully after 10 years, they will be feeling strong to keep this program going with other types of funding.
This first phase of Proyecto Juntos serves as a starting point for a deeper examination of mental health disparities in southeastern Arizona. It's a call to action for policymakers, healthcare providers, community leaders, and residents to collaborate to build a more equitable and supportive system for those struggling in isolation.
White bread anywhere? Oh, we got lots of white bread. And right here. Right here. I get it from my other guy. He likes white bread.
Hi, I'm Tom McNamara, host of Arizona Illustrated. Thank you for watching this story from our show. And for more local content from Arizona Illustrated, just click right here.